Did you know that many cases of psoriatic arthritis are misdiagnosed or delayed, sometimes for many years? Imagine seeing one specialist for your skin issues and another one for your joints, but no one connects the dots. This can mean that you are living with untreated symptoms for far too long. Today, I'm going to highlight the 10 warning signs of psoriatic arthritis. And we are going to build up from the least common to the most critical signs, some that you cannot ignore, some that can be easily missed in the early stages of your disease. Hi, I'm Dr. Girnita. I am a rheumatologist who has been treating people with psoriatic arthritis for more than 15 years. 2 to 3% of the world population has psoriasis, which is an autoimmune disease affecting primarily the skin. You probably did not know that psoriasis is not only a skin disease, but rather a disease that can affect many organs. It can take time and expertise to put all the things together and understand how they are actually related to your skin condition. However, only 25 to 30% of people will develop a form of arthritis that we call psoriatic arthritis. Most of these people present with a skin disease first, then years later will develop the arthritis. Most people are between the age of 30 and 50 when they first present with symptoms of psoriasis, and both men and women are affected equally by this disease. Now, if you're asking me, is there a genetic predisposition to develop psoriasis? I would say yes, there is, because in most people, about actually 40% of them, they will have one parent or someone in their family suffering from psoriasis. Now, what are those 10 warning signs of psoriatic arthritis? Let's begin. Sign number 10. We are starting off with something unexpected, gut inflammation. Believe it or not, psoriatic arthritis is often associated with digestive issues, such as bloating, abdominal pain, or even diarrhea. These symptoms are easily dismissed as minor digestive issues, but they are actually part of the bigger inflammatory process affecting your body. And if these symptoms persist, especially along with joint pain, it's time to look closer. But could gut issues signal arthritis? Surprisingly, yes. As I mentioned, gut inflammation is more common in people with psoriatic arthritis than people actually realize. Not only that, but about 1.2% of people with psoriasis will also develop an inflammatory bowel disease like Crohn's or ulcerative colitis in the next few years. So pay attention to these signs, as getting early to be evaluated will help you get the right treatment. Now, let me give you a tip. Diet matters. As I talk in my other videos, what you eat is what you are. And foods like sugar, processed foods, certain vegetable oils are detrimental to your gut and will only accentuate the inflammation and maintain the gut inflammation. Sign number 9. Next, we have eye inflammation, which can present as iritis or uveitis. Now, who would think that your skin disease is linked to your eyes? Eye inflammation or uveitis is actually a red flag for certain types of autoimmune diseases like psoriatic arthritis or ankylosing spondylitis. And uveitis is not so rare as you think. It can appear in about 7 to 20% of people with psoriasis. But how does this present? People will present with severe pain, blurry vision, and severe sensitivity to light. Attention! Uveitis is an emergency. It can cause severe damage to your eyes. And without treatment, uveitis can lead to vision problems or even to loss of vision. So it's essential to act quickly and get to see an eye doctor. Of course, uveitis can have many other causes, from infections to sarcoidosis to even trauma. So the eye doctor will start you on the treatment, but will also initiate an evaluation that will include an autoimmune panel to test you to see if you are actually suffering from an autoimmune disease. Now let me give you a tip. If you have one episode of uveitis in one eye, and then you have a repeat of that episode in the same eye, or actually the opposite eye in a few months or a few years, ask your doctor to refer you to an autoimmune disease specialist like me to be evaluated further. Now let's stop for a minute. I noticed that 85% of you that are watching aren't subscribed. If you are finding value in my videos, go ahead and subscribe now before you forget. And while you are there, hit that like button because it helps YouTube recommend this video to more people that need this valuable information on autoimmune diseases, rheumatology, and many more. Thank you. Let's go back to other signs of psoriatic arthritis. Sign number 8. This is a subtle but yet incredibly telling sign. Nail changes. Many patients with psoriasis see changes in their nails well before they experience joint pain. This can look like pits or indentation, white spots, or even the nails will start lifting from the nail bed. Often these changes are overlooked or mistaken as nail injuries or vitamin deficiency, but if you see these nail changes, especially with a family history of psoriasis, it's something that you need to mention to your doctor. So next time when you are trimming your nails, take a closer look. These small changes can reveal a lot. Sign number 7. Here is one that many of you know. Psoriasis itself. Psoriasis can often appear as red, scaly patches on certain areas like your scalp, your elbows, knees, and even around the belly button. But here is the twist. While a majority of people with skin psoriasis won't develop psoriatic arthritis, and actually only 25% of people with skin disease will actually develop the arthritis, so managing the skin disease ahead of the time will have a better chance for you to avoid the arthritis. That is why, if you have the skin disease, contact a dermatologist, a skin doctor, to put you on treatment for your skin. And today there are many options for treating the skin, from creams to UV light therapy to medications and even biologics. Now let's go to one of the most painful signs of psoriatic arthritis, one that can make your life very difficult. Sign number 6. Psoriatic arthritis can cause painful inflammation in tendons, particularly in areas like Achilles tendon or even the soles of your feet. The inflammation of the tendons, we call it tendonitis, and tendonitis can be very stubborn to respond to treatments. Because tendons will lack vessels, they heal very slowly, and the pain can be persistent for many months. Many patients report frequent episodes of plantar fasciitis, which can make their mornings very challenging. Did you have unexplained tendon pain that just didn't want to go away? That can be a sign of psoriatic arthritis. Sign number 5. Next, let's talk about elbow pain. Very rarely elbows are affected by inflammation, but when they are, then patient can describe pain on the inside or on the outside of the elbow. If the pain is on the inside of the elbow, we call this golfer's elbow. Now think about the golfer who will swing the club towards the inside. This will cause pain, for example, when you carry a suitcase, keeping your palm up. If the pain is on the outside of the elbow, then we call this tennis elbow. Now think about swinging the tennis racket outside. This can cause pain with shaking hands or lifting a heavy plate. Either way, your pain can be severe, and again, it is very hard to respond to treatment. Sign number 4. Have you ever noticed your fingers looking more like sausages? Or have you noticed that in your toes? That swelling might not be what you think. As a rheumatologist, when I see fingers that look like little sausages, I immediately think about something specific that I call dactylitis. And trust me, this is not your typical joint swelling. Dactylitis, or saucy digits as we often call it, it is when your entire finger or entire toe will swell up uniformly. Imagine like you have a balloon inside and that will inflate. Unlike regular joint swelling that only affects your joint, this swelling transforms the whole finger or the whole toe in what it looks like a sausage. And this is not just interesting to look at it. It's actually a clue that would help me understand that this might be related to psoriatic arthritis. Sign number 3. Now, because we talked about the swelling in the fingers, let me tell you that people with psoriatic arthritis can present with pain and swelling in the joints. But pay attention. There is something unique about how psoriatic arthritis presents. Unlike rheumatoid arthritis, where pain is often symmetrical, bilateral, affecting both hands, both feet, psoriatic arthritis can affect joints in an uneven and asymmetrical pattern. This means that you may have pain and swelling in one knee and then not in the other, in one finger or a few fingers and not the others, or in a few toes and not the others. Psoriatic arthritis can potentially affect all your joints, but not in a symmetrical pattern. For example, the most frequent areas in the hands are the distal interphalangeal joints, the proximal interphalangeal joints, and sometimes the wrist, but you can have one or two fingers affected in the right hand and then the left wrist. Sign number 2. We are now closely racing to the most common signs of psoriatic arthritis. Besides your joints, the back can also be affected. The cervical spine, the thoracic spine, and also the lumbar and sacroiliac joints can be affected. But most of the time, the cervical spine and the sacroiliac joints are involved. When the cervical spine is affected, people have difficulties to turn their heads, especially when driving, and that can be very bothersome. When the lower back and the SI joints are affected, people will report pain in the lower back, the buttock area, or even the hips. Sleeping at nighttime can be difficult as people have to adjust in the bed all the time because they have pain. Now, sitting in the same position for a long time can also be difficult because it will also cause more pain. And now, the number one sign that makes that distinction between what type of pain people experience, if it's the pain caused by mechanical issues or if it's caused by inflammation or an inflammatory arthritis, is morning stiffness. If you are a patient younger than 45 years old, waking up in the morning with a lot of stiffness in your joints, in the upper or lower back, stiffness that will last for more than an hour every single day, no, this is not related to your aging. If movement relieves your stiffness, and if you feel much better with exercise, stretching, and even a hot shower, this might also be a sign of psoriatic arthritis. The morning stiffness is a specific characteristic of inflammatory arthritis, and that will be, as I said, prolonged again over 1 hour and will always improve with movement. Now, all these signs are clues for psoriatic arthritis, but there is so much more that you need to learn about how to treat this disease. So make sure you watch this video where I explain exactly that.